everyone, this is Paul from Ortho Eval, and today what we're going to talk to you about is the FADIR test, or the hip internal rotation test. Now, I always like to explain why you do a special test. I think that's very important, that you not only just perform the test, but you understand why you are performing that test. So the reason we would do this is if a patient came in and they had some groin pain, they had difficulty reaching their feet, having a hard time putting their socks or shoes on, maybe they had a hard time bending over to pick something up, and they get this kind of pinch in the front of the hip. So what we're looking for is if they are getting some sort of a bony impingement with the acetabulum hitting on the femoral head. Sometimes there's overgrowth of that acetabulum and spurs causing that. You could have a pincer lesion, or you can even have a cam type lesion where the space where the acetabulum falls into the neck of the femur is filled in, so it's, instead of being like this, it is more like that and pinches earlier, and that will also cause some pinching in the hip. You can even see some discomfort with people with arthritis, but in the younger population, you want to be looking at some sort of bony impingement. So the way you do this test is you take the patient, relax them, put them flat on their back, and I like to hold the knee and I like to hold the bottom of the foot, and what you do is you take the hip into hip flexion, slight adduction, and internally rotate. And as you can see with this young lady, she actually is quite tight and has a little bit of impingement, and it's a little uncomfortable also. And her mother has a significant impingement of the hip also, so we may have a little genetic predisposition here. So the FADIR test, or the hip internal impingement test, is hip flexion, adduction, passive internal rotation, causes some discomfort in the groin area. Thanks. More information regarding hip dysfunction, how to evaluate it, and how to treat it, make sure you go to our YouTube channel and check out our playlist on hip dysfunction, and you'll find numerous videos on how to evaluate the hip better, and some treatment techniques and management skills that we talk about to help guide you so that you feel more comfortable with your evaluation skills. You can also get in touch with me at paul@orthoevalpal.com. Make sure you subscribe to our channel, please like our videos, and I hope you have a great day.